Now in this video, I want to show you how you'd go about documenting an initial examination or a new patient. So let's look at the schedule. This is a day that we're not really open, it's blocked out, but I was able to put a patient up here, a fake patient. You see some blue, so let's think about what's happens. The patient checks in the main office, or they check in at reception. The receptionist is going to check them in, hit check-in. Okay, it's going to go through a variety of different things. We're not going to worry about that necessarily, but now this patient's green. So this lets you know the patient is checked in. Now, how to get to the EMR? There's a couple different ways to do it. You can do a right click and say, and then assuming the patient's here, you want to document on them. Right click, open in the EMR. So now we're into the EMR, and you can see I right clicked it. We're in this screen here. Let me show you a different way though to do it too. So back at the schedule, here we are, the patient checked in. I can just go down here and click EMR also, and because I have my office schedule and I have lab 1 displayed, Mike Marquette's popping up. Now if I only had lab 2 displayed, that patient wouldn't be there, but because I had lab 1 displayed, it's there. So I want to start documenting this patient. I can click it, it pulls in the chart, and we're right back where we were before. So how this system is set up, this is an encounter base. So every time you open a note, every time you open something up, it's considered a new note. So you look up here, you'll see encounter your history. This is the session we're in right now. If we develop a problem list for this patient, let's say they've had a stroke, they've had a arthritis, whatever, that'll all pop up in here. As we develop a patient history, that will pop up in there. If we're measuring height, weight, BMI, temperature, maybe not necessarily for rehab, but some other professions might do that, we can see the running total of all these things, pain assessment, etc. You can change this display if you want to. You can click this little clock up here, and then we have allergies, medication, timeline. I personally prefer to look at it this way, and that doesn't really fit into what we're doing in our clinic. So what we're doing, we have a summary is over there. This is the summary tab. Let's go to the history. So we have the patient come in, and they're coming in to see us. Based on how we collect the data, how we interview them, we have different boxes to check. So we go through, and this could be something that's done from their medical chart themselves, that they report this, or should they the screening form that they fill out ahead of time, or things that we get. Well, we find out that Mike Marquette had a fracture in the past, he has high blood pressure, cholesterol, and also has had surgery in the past. That medical history, I can come down here and say what kind of surgery I had. I had surgery for a broken wrist at one point, so that's documented. I can even put the year of 2013, let's say. And again, this wouldn't be for this patient, obviously, but things about pregnancy. I can put in allergies. If there's no allergies, that's good. Maybe more important, if we're thinking about certain agents we're putting on their skin, to note that. And if we need to, we can put right hand. And if you notice what's happening, as I check things, everything's popping up here. Okay, so this summary is a running tab of everything that you're doing. The other thing you'll notice is that if I don't check something, it doesn't pop up here as if I didn't do it. Only the important stuff comes up. So we go down past medical history, go into social history. So as you're interviewing Mike Marquette, you might be able to take some of this, or if we're using a scribe method where one student's doing the questions and the other is filling this out. And, Mr. Marquette, are you married? Yes, I'm married. Name, my wife's name is Sue. A number of children. I might have 3 children. If that's important to know, sometimes it is, sometimes it isn't. Education is important to know. I have some high school, rarely use alcohol, but I do smoke daily. Okay, you notice I didn't check beer or wine. That didn't pop up there. Only the information I checked popped in here. If I get more information, I can find out, how many packs per day, a pack a day I smoke, total years. I've smoked this for 20 years. And you can get that information like that. It is a good occasionally to hit the save button. So I hit save. Now all that information is hopefully saved. It doesn't disappear as I go. If it's necessary, you can put in the type of surgery history if you want to. What you'll find with the system is very redundant. So I could have listed all my surgeries up here, right? I could have done that, and you saw I did that for the broken wrist, or I could do it here. At this point in the clinic, it's probably not that important on where you document it, just as long as as long as you're putting it somewhere. So it doesn't matter whether it's here or there, probably not for what we're concerned about, but we do document that. And then current medications. We have this really as a blank box. So if the person takes, aspirin for heart disease, and they might be on a beta blocker for their hypertension, and we can go on and on about pain medication, multivitamin, whatever the case might be, what we might do for this patient. It can be documented right there. And again, I'm going to hit save, record that, and again, it pops up there. This is my history. So this is information that carries across every single documentation. So every time I open up a chart and I click on history, this will be in there. Okay, so it pops up as we go. Again, it's good to hit save as we go. Let's go over to assessment now. Think about this as where we're doing our primary note, and what you need to do, make sure you're in the right template at all times. We are doing an evaluation, and I have a few more things on here because of my role in the clinic, but you will likely only see interprofessional rehab eval in the therapy note. Make sure rehab eval is checked, and that's our default. Start time, so we started seeing the patient at 3 o'clock, and we don't really have a firm policy on how we do it, but let's say we use military time. We started at 1500, and it was an hour session. We can do that. If you want to be direct, you can put 60 minutes in there, however you do that. History of present condition. So this is initial eval. We can just check that, check the date that it happened, the onset date. If this is something that started years ago or months ago, you can document it that way. Referring provider, we can do a self referral. Okay, and we have balance issues, let's say. Again, there's probably no body part evaluated in something as generic as balance issues. And you kind of type in things as you go. And the key thing is that you're seeing that as I type, things pop up there, and rehab precautions, no rehab precautions. I can do the person's height and weight here, but I want to encourage you not to document it here, and I'll show you why in a little bit. So we can work our way down. And again, for some of these things, it's going to be important that we document weight-bearing status. If we're talking about a fracture, we can document some things there, or you can just use the text box and say, patient is coming to therapy for balance issues that began 1 month ago, and again, you keep going along that lines. Hit save if we want to. Now we go in current functional abilities, and as rehab professionals, this might be where we put a lot of things in here. So we're looking at a community-based workplace, in the home, driving, mobility, even has some issues here with swallowing, adaptive equipment, etc. Moving down this way, subjective, the reason why the patient's seeking care, prior level of function, were they completely independent, etc., or is this a long-standing issue? You can check pain. Did they have pain? Yes. Location, the right ankle, and work our way down. And that's a 4 out of a 10 if we do that. We say we use a numeric rating scale, so just quality consistent about that. Maybe it's a sharp pain, documenting all those things. Okay, and we can also document post-session if we'd like to do that too. Objectives set up in a way where each profession can document what they did during that objective, during this initial exam. And we do this because we want to be able to separate who is doing what in the note. If based on how we do this, if we weren't doing it this way, it could look like that the physical therapist was assessing vocalization, where actually it was a speech language pathologist doing this. So what you would do, each profession would type in here. So this is physical therapy, and we worked on when we did the Berg balance scale, and they scored a 42 out of 56. We might put that in here. What the key thing to do is to document who the student is and then who that supervisor is. So it might be Bill Smith is the student, but I am the supervisor. And it's important that we put initials, professional designation, if we can after this. And Billy should be an SPT, a student physical therapist. But down here, occupational therapy, and then the OT would write their note. So worked on So you can see it might be something that the OT would write specific to that. And again, they're putting in their students' names. That professional designation is noted as you go. And I think you probably get the point with this. We could do you know nursing here or speech, whatever the case may be, and they're doing their individual note as we go. Again, we always want to hit save as we go along. We don't want to have to retype things in. There's about 5 or 6 different boxes for that. Treatment rendered, skip over that. There's really no need to do that. Assessment. This is where the students and the faculty advisor should be coming together and figuring out what's going on. So our therapy diagnosis, we would write in here, and this is something that all the professionals contributed to. And it can be something very direct about what the patient's problems are, what's impacting. This is where the assessment comes together. And rehab potential, hopefully if we're going to see them, they have potential, but we might evaluate someone that we really don't feel like they have potential, they've met that information, but we'll pretend Mr. Marquette has that. Motivation for therapy, we talked about a wife earlier. Wife and children are committed to help patient, and work our way down this way as we go. Learning assessment, if there's things that we want to say what his learning preferences are, if he tells you, you know what, I have a really hard time reading because of my dyslexia, and he wants a video and he wants demonstration. That's good to know, to document that. And barriers, it might be again, if he has reading comprehension or reading abilities, we might document something like that if there's that. If we provide education, we can do that there. Plan, again, this is something that should be done based on an interprofessional examination. So how many times we want to see them, when do we want to see them, based on the nature of our clinic. It's probably going to be once a week, and we might only see them 2, 3, 4 times based on volume. But if we feel like they really need to be here a long time, we can document that. And plan, typically you would put your plan down here that as a group we're going to focus on these things, and that's where our focus is going to be on. At times, we have seen students and faculty decide to focus or document, PT-specific plans up here, or OT-specific plans. So if there's really something that's discipline-specific, it could be documented up here in the objective. That's kind of based on how it feels at the time for the patient. But typically, we want to have an overall plan that we're going to be working on as a team. Student and faculty sign up, even though up above, we did document which student and supervisor are there. At the end, we want to have a grand list of this. So every student and every faculty advisor or licensed professional should be documented here, even though it's repetitive from above. And I'll show you why that's important in a little bit. So you see I've typed those names in at this point. There is an exam tab that's set up. There's a template set up where you can be very, in almost like a table-like fashion, list out any kind of exercises that you might have done with the person during that initial exam or even during future sessions. And you can type things in on what you did, and you end up with a nice table in the note. So again, I'll hit save. If you're catching on, I hit save a lot just to ensure there's no problems. Now you can document what you did for the exercises here, but again, going back to the assessment tab, we can go up to the objective, and I could document right here what I did for interventions also. It's really about preference and what feels like it's going to work right. Next, let's go to the goals. These are meant to be interprofessional goals, so you have to choose the template. You want to choose interprofessional goals. These are things set up together as a team. So I just wrote 2 very generic goals, one about a Berg balance test and one maybe about maintaining balance during meal preparation. So I'm hitting save as I go. And there's numerous different boxes for this, as you see. Vitals, that's one thing I want to point out. If you're going to do height and weight, this is a good place to put it. So if the person is 5'10", we put that in there, and let's say they weigh 180 pounds. The nice thing about that, you see it calculates the BMI for you. So you have that information here. If you took blood pressure, which hopefully you did, maybe it's well controlled, today. You can just write it in there. It's always good to say which arm, and their pulse rate was 68, let's say, and even a regular rhythm. If you did pulse oximetry, you see that can go down here. Pain assessment you can also document at this point. So again, hit my save button. So now we have our note done. Everything's been done. We've documented everything, and if we want to, we can go back in here and we can look at each tab and maybe change something. If there was something that changed, we can do that. Or if we want to add a goal, we can do that. You can, if you notice, when you go through these different tabs, the summary changes. Okay, so if I go to exam, this is just the summary for that tab, or if I go to assessment, it's just the summary for that tab. And you see these green check marks there, that tells you that the note's been saved. But again, it never hurts to hit save. Now let's go to our SOAP note. So this is what's going to end up printing out and being our documentation. So what you do, you see the note comes in here, you have to use this drop down menu and you have to pick interprofessional evaluation, because that's what we did in evaluation. And what it does, it pulls everything in and it builds the note for us. So now we see it says St. Ambrose has our contact information. We can go down and scroll. We have our history, so you see everything that I typed in as we go. Pain, everything along this lines. And you notice within the note there's these subsections. So you see physical therapy. What I did, there's a point for us to sign this at that to document this is what we did. You see occupational therapy has the same thing. We did type nursing in. We didn't put a note. If we would put names there, those lines would have appeared. Here's our assessment, our plan, our goals are also here, as you see that way. It would be nice if they were on separate lines, but they're all kind of merged together. And then you see the signatures right there. Let's say I look at something and say, geez, nursing really should have had more information. So I can go back to assessment, go down to this point, and nursing. And I decided to put better documentation. So nursing provided patient education on blood pressure, the student's name in there, and do it that way. Hit save again. Okay, now we go back to SOAP note. That's not there. You say, well, where did it go? If you type something in, it's not there. This is a great button to hit, this plus with the arrow. Click this. And you see it's working. And now hopefully, if this all worked right, we will see a nursing note down there. And there we go. The nursing's in there. So if there's any ever time you didn't have something show up, use this button right there. It'll upload everything in. So you should be at the point now that the team agrees on this note. Everyone feels good about it. The faculty have looked it over. They've talked to you about it. Now we need to finalize the note. So I can hit here. I can hit save the note. So now this SOAP note is saved. Okay, so it's in the system. It's saved. What I can do now is finalize the note. So I would pin the note. You all have pin numbers. I'll put my pin in. And when I hit enter, this will become a final note. For students, what will happen when you hit pin, it'll then tell you you need to choose a faculty member. And that faculty member will then have to provide an electronic signature on it also. But you put your pin in. I'm just going to hit enter. And it says note's already there. I want to hit yes and override that note. Okay, so the note's done. At this point, I can take the laptop down to the printer. I'm going to hit print. We see what the note looks like, and you can see how it's formatted, laid out. I'm going to go ahead and hit print, print it off, and then after I print it, we need to get manual signatures or authentic signatures on here. So Billy signs it, Mike signs it, Harry, Sue, etc. It gets 3-hole punch or 2-hole punch put in the patient's chart, and again we sign again. Down here, there's 2 sections you're signing off on. You're signing off on your individual section, but then you're also signing off on the whole encounter and the whole evaluation. So this is your overview of how to do the initial examination, that first session with the patient. Future videos will show you how to do follow-up sessions.